I'm Dr. Diluk Senadeera, an obstetrician and gynecologist, works at the Durdans Hospital. Fibroids are a very common condition which are being diagnosed in middle-aged women mostly. If you are a woman who's been diagnosed with a fibroid, you don't have to get frightened. The scientific fact is these are not cancers. 1 or 2 smooth muscle cells in your womb starts to divide rapidly and forms into a small lump or a tumor. So the next question, as I said before, it's not a cancer. You don't need to get alarmed. Being Asians and certain ethnicities such as Black African women, we have a higher tendency to have fibroids. Mostly these fibroids are asymptomatic unless you are being diagnosed with a difficulty or symptoms. You do not have to go through treatments. Fibroids, even though they are mostly asymptomatic, they can cause a lot of trouble. We categorize the fibroids according to the location and the size of the fibroid. Let's say if the fibroids are towards the inside of the womb cavity, you might be a person who's prone to get a lot of bleeding, very heavy menstrual flow. Same goes if the fibroids are within the womb wall of the womb. This can cause various symptoms, including bit of pain. If the fibroids are outside the womb and compressing onto your bladder or maybe bowel, the rectum, it can cause different symptoms. If you are having a fibroid pressing onto your bladder, you may be getting symptoms such as high frequency pain while passing urine, which we call small bladder syndrome. Same goes with the rectum. You might be getting constipation and all the other bowel related symptoms. However, these symptoms are not very common. So if you are a person who's suffering from any of these symptoms, it's very important to get a proper examination and evaluation. Rarely, fibroids can cause bad symptoms such as back pain. Why is it bad? A fibroid can compress onto your ureters, which is a sign that your kidney is getting blocked. So this can give rise to sinister complications. So it is very, very important to have a proper evaluation and a complete checkup if you are a person who's been diagnosed with fibroids. Another common question people come and ask us is whether there are any other medication other than surgery. Yes, there are. There are certain injections and different oral medications which can be taken in the tablet form. These oral medications and injections are not without side effects. And another problem with these oral drugs are, once you stop the medication, fibroids tend to regrow to their previous size. So if you are a person who's definitely needing treatment, the definitive treatment would be a surgery. If you are thinking of a surgery, there are many kinds of surgeries that can be done for a fibroid. Your doctor will give a proper explanation about these different surgeries. One way that we can take out a fibroid is through the hysteroscope. That is a tiny camera which can be inserted into your womb through the neck of the womb, that is the cervix. If the fibroid is small, which is less than 3 centimeters, that can be taken out through this camera. And the advantages of this surgery is it's totally pain-free. You go home very early and you do not get any surgical scars. The other commonest form is an open surgery. If you are a person who's having large number of fibroids and if the fibroids are quite big, you might be needing an open surgery. One of the newer methods, one of the most popular methods today are laparoscopic surgery. Fibroids can very well be taken out through the laparoscope as well. We call it a laparoscopic myomectomy, a keyhole surgery. Keyhole surgeries do have a lot of advantages. It's with minimal pain and very small amount of scarring. You don't have literally large surgical scars and you get very minimal bleeding as well. So your post-operative surgical stay in the hospital is much shorter compared to an open version. This surgery is being done through 3 or 4 cameras, small tubes that are being inserted into your tummy which is the size of about half a centimeter to 1 centimeter. We can separate the fibroids from the womb through these cameras and then take it out through a morcellator. That is, we cut out these large fibroids into very small pieces through this special instrument which is freely available at Durdans Hospital and all the other advanced surgical equipments. So we can take these parts of fibroid through the camera out without giving you any large surgical scars. We categorize the fibroids according to the position of the fibroids. Some of these types can cause fertility issues, especially if they are mechanically obstructing those important tiny little tubes, the fallopian tubes, or if they are obstructing the ovum pickup, the egg pickup. They can cause fertility issues. However, it's not a common occurrence. So if you are a person who's been diagnosed with fibroids before, and if you have had miscarriages or any other fertility issues before, it's best to have a full checkup with your obstetrician. If your fibroids are in positions which need certain treatments, that should be arranged before getting into a pregnancy again. So finally, if you are a person who's been diagnosed with fibroids before, or if you are a person who's suffering from any of the previous symptoms that we talked about, it's best to present to the hospital and have a proper assessment, probably with an ultrasound scan and with further investigations. Durdans Hospital is very well equipped with all the advanced technologies for proper diagnosis as well as for therapeutic procedures, starting from your advanced laparoscopic sets to morcellators and all the other advanced technologies, it's available. So if you are a person who's suffering from any of those alarming symptoms, it's always good to present your doctor and have a proper evaluation.